Hi, everyone, and welcome to today's chat. My name is Tara, and I'm a team member here at Understood. Today, we'll be talking about improving focus and concentration, and we're so excited to have Stephanie Sarkis, Ph.D., joining us for this chat. Hi, Stephanie.
Hi, Tara. How are you?
I'm well, thank you. How are you?
I'm great.
Great. Stephanie, would you like to take a moment just to introduce yourself to the folks joining us?
Sure. I'm Dr. Stephanie Sarkis. I'm a psychotherapist in private practice in Tampa, and I'm a clinical specialist in child and adolescent counseling, and also AMCA, which is a American Mental Health Counselors Association diplomat. So that means I went to way more school and what's healthy for a person to go to, and I've worked with kids for about 20 years or so. So I'm happy to entertain any parent questions.
Great. Thank you so much. Before we get started, I do want to remind those joining us that we will be taking questions. We will get to as many as we can. Please feel free to type in your question in the chat box that's listed to the side of your screen. It is helpful if you include your child's age so that Stephanie can provide you with a more targeted response. I said a lot, so let's get started. Stephanie, what are some of the reasons that kids might have a hard time focusing?
Well, first, it depends on whether it's intermittent, whether it's once in a while, if it's constant. If it's once in a while, it could be lack of sleep. It could be stress, like maybe parents are separating or divorcing, or new baby in the home.
Okay.
It could be that there's some bullying going on. It could be allergies, being sick. So, and then also if it's happening more days than not, it could possibly be something like ADHD. And that happens not just at school, but in other areas of life as well.
Got it. And so what can parents do when a child is having a hard time focusing, like, for example, on homework?
Well, the American Academy of Pediatrics recommends 10 minutes max of homework per grade of the child, and usually kids are getting way more than that. So if you have a 504 IEP for your child, you can check off reduction in homework on that plan. You can also, I recommend that parents turn in any work that has not been covered in class, but the child has homework for it. I recommend that parents turn that in not completed.
Okay.
It just stresses everybody out when it hasn't been covered in class, and then parents and kids are trying to figure out what the assignment is. So always turn that back in with a note saying this hasn't been covered in class.
Got it. And what do you think about brain breaks or movement breaks between study sessions?
I like moving during study sessions. So you can have kids sit on a Pilates ball. You can have them, there are little bicycle pedals you can put under the desk that are completely silent.
Okay.
Have them move, because when you stimulate the cerebellum, that's the movement part of your brain in the back, you're better able to focus on the frontal lobes. And that's where your planning, forethought, all your executive functions are. And that's what's impacted when you're tired or sick or have ADHD. So move during studying and then take breaks. So maybe have a younger child do homework for about 20 minutes, then take a 15-minute break and go outside. There's something about being outside that kind of resets the brain. So do that for around 15 minutes, like I said, and then go back into the study.
Okay. And I guess, in your experience or in your career background, have you noticed that that technique is helpful for students?
Yes, definitely. I think if you're moving, I think that's our body's natural inclination. And plus, kids are made to move. They're not made to sit still all day. I've seen some classrooms with stand-up desks where the kids have desks that are at kid height, and they'll dance around and finish their homework. And I think it's a great idea to incorporate that movement. And then there's also some curriculums that have a minute of full-range body motion in between doing subjects. So they'll say, okay, so we're closing our spelling books. Now we're going to do a minute of jumping jacks. And now we're going to do math. And studies have found that when you do exercise in between subjects, you're able to absorb more of what you were just taught, and you're able to take in more of what you're going to learn next. Because when you move, you increase dopamine, and dopamine, an increase of that helps you focus.
Got it. We're starting to get some parent questions in, which is great. Roxy, I believe, wants to go back to a point you made earlier. The question is, how does a parent know if something is not being covered in class? My child doesn't always know or remember.
Well, there are a lot of online programs with the schools that you can look up what the teacher's posting. If the teacher hasn't posted, you can ask the teacher to post that information. A lot of teachers are doing email with parents, and then you can also just ask the teacher, too. A lot of teachers have made themselves available to ask questions about that. So a lot of it is just teacher report.
Okay.
And then just keeping open communication with them.
Got it. Our next question is, what if there isn't an IEP in place at school?
If there is an IEP in place, so a 504 plan means that you are in the regular classroom and you get some additional accommodations like seating near the front of the room, reduction in homework, extended time on tests. IEP means you're getting additional services. So that could mean you're going to gifted or speech language or some other type of thing, having an aide in the room. So that requires an IEP. That's an individualized education plan. So you might need a 504, might need IEP. I would always go to the head of guidance and ask them what your child needs in particular if you need accommodations.
Okay. I want to ask you about some more strategies. What are your thoughts about mindfulness or meditation strategies?
Mindfulness is a form of meditation where you're moving while you're meditating. So it's pretty kid-friendly and also ADHD-friendly. That has been found in studies to greatly increase attention. So I recommend that. And it could be as simple as asking kids to name 3 things they can see, 3 things they can hear, and 3 things they can feel. That's a simple mindfulness exercise. And that the idea is that the more your brain does that, the more your brain will automatically refocus when it's off task.
Got it. And so my next question is, what can be done in the classroom for kids who are having a hard time staying focused?
Well, I think first to have multimodal teaching.
Okay.
We need to do more hands-on teaching. We need to do centers around the room. I know when I taught, I had different places that kids could walk to and do a hands-on activity, and that really helped, especially for my students that had ADHD. So I think also having more breaks during that time, letting kids move around. Having them just kind of walk around the classroom, do some exercises, I think that would really help. Again, kids are not made to sit still. I think making sure that kids keep moving is one of the biggest differences that teachers can make. I think also having a nonverbal cue with the student that they're having some issues so they can kind of tug on their ear if they need the teacher's attention or scratch their head, or the teacher can also scratch their head or send some kind of signal that the other kids don't know about that they're having problems paying attention.
That was super helpful. That's super helpful. And you raised a really great point there. The next question is, what's the next step if your child isn't accepted for an IEP?
If your child isn't accepted for an IEP, you do have the right to appeal. So there's information on Understood about that. There's information on rightslaw.com about that, about the appeal process.
Very nice. And are there accommodations parents should consider if their child has an IEP and gets special education services at school?
So if you have accommodations for a child with ADHD, usually the ones I recommend are seated close to the teacher, away from distracting stimuli, reduction in homework, extended time on testing in a separate and quiet location. Also having the teacher check the backpack before the child goes home, weekly behavior reports, not posting behavior on the wall. So for instance, doing the smiley face, frowny face system, or doing the stoplight system, the green, yellow, red for behavior that is not posted publicly. And that helps all kids to not post that. So those are just some of the accommodations. Also not having kids get in trouble for doing normal movement in the classroom or a little bit of extra movement.
Okay. We have a parent that has a question. I have a first grader who has a stand-up desk and is allowed lots of movement, but starts to self-harm when frustrated. Is this common?
It can be, and that's something where I talk to your pediatrician or also talk to a mental health professional about that, because it sounds like your little guy's suffering, so we definitely don't want that. So I would definitely talk to a professional.
Okay. And do students with ADHD often become depressed or anxious? Is this common or uncommon?
Being depressed and anxious happens about 50% of the time when you have ADHD. That's diagnosable anxiety and depression. So overall, most people with ADHD do have increased rates of depression and anxiety. Again, 50% have depression and anxiety to the point where it's impacting their quality of life. They're diagnosed with an anxiety or mood disorder.
Here's a really good one. We have mom of a fifth grader just starting this journey of evaluation. We tried the brain breaks, but starting up again seems to be more of a challenge. Do you have any thoughts on that? And a follow-up is, are fidgets a good idea? They seem to be a distraction more than a help.
So the first one's about timing?
Yes.
Okay. So I recommend a visual timer. So when you're taking a break from doing homework, so the visual timer, it has red color that gets smaller and smaller and smaller as as time goes by. So it lets the kid know, like visually, because kids don't have a concept of time really. So when you see the timer, that also lets them know it's time to transition, because transitioning is really hard for kids with attention problems, particularly if they have ADHD. And you can also say, okay, 10 minutes, 5 minutes before we transition, 2 minutes, 1 minute, and that really helps. But again, kids don't really have a concept of time, but they know that something's coming when you say those words.
Okay. Our next parent says, my son has been diagnosed with ADHD and attentive. He is highlight skilled socially and has excellent communication skills. He has trouble focusing and getting started on work. He is frustrated when he sometimes gets stuck while explaining something to someone. Is that typical, and what can we do to help him?
One of the executive functions that's impaired in ADHD is, again, that's in the frontal lobe. That's called reconstitution of information, which means the message that I'm given and the message I give back to you gets garbled.
Okay.
So sometimes it's helpful for kids to write something out instead of say it instead of writing it out. It depends on every kid's different. So sometimes the way that you output that communication helps. It could be just to ask questions too of your child if you're not sure if they understood correctly, or if you give an instruction to your child, give one instruction at a time and have them repeat it back to you. And also write it down too. That's helpful. For instance, in the morning, write down the morning routine on the bathroom mirror. And you also asked about fidgets too.
Yes, I did.
So fidgets, I think they can be really helpful. I think that it depends on the style of fidget.
Okay.
I give kids koosh balls, those little sea urchin looking things, and they're little mini koosh balls so the other kids can't really see them playing with them under the desk.
Okay.
I think that can help. It really depends on how much. I don't think it needs to have a lot of lights and extra stuff. I think it's anything that you can kind of fiddle with.
Got it. Our next parent says, how do you help a college student who doesn't seem to be very productive while studying on his own and has never received any accommodations?
So a college student that doesn't seem to be productive studying on their own has never received accommodations. I'm going to assume they have not been diagnosed with ADHD, so you might want to get an evaluation.
Okay.
And with a letter from your clinician, you can apply for accommodations at the college. And that's all colleges need. They just need a letter from your clinician stating that you have a diagnosis. And then they can also give a list of recommended accommodations as well.
Our next question comes from Stephanie. Stephanie would like to know, what are some strategies for readjusting focus with a student's sensory disorder?
So sensory disorder is when it's not a diagnostic, we use the DSM to diagnose, and that's not one of our diagnostic categories. It was proposed for the latest edition of the DSM and was turned down. But sensory disorder, sensory issues are when you have heightened sensitivity to auditory, visual cues. I find it helpful to just have a little area of your house that is low in sensory stimulation, like some low lighting, low music, just a place where kids can kind of go to chill out, when they start getting frustrated.
One parent would like to know, have you ever heard of a pocket monitoring system that pokes students to keep them focusing?
Yeah, that's one of those systems I think that buzzes students. Yeah, those come in all different varieties. That's actually kind of a mindfulness technique, but I generally don't recommend it because kids can be in focus. Because ADHD and other problems focusing, you can have hyperfocus too. It's not just lack of focus.
Okay.
So sometimes those kind of systems zap kids out of their focus, which is exactly what you don't want them to do.
Got it. Makes sense. What are some techniques to address avoiding homework with students?
Well, first we have to look at what homework they're being assigned. Again, are they being assigned stuff that was not covered in class? Is it too much homework for that grade of child? Again, AAP says 5 minutes max of homework per grade of the child. So look at how much homework kids are being given, look at the content of it. Are kids being able to kind of unwind when they come home from school? So that's another thing too. So really look at what the kids are doing for homework. And also try to split it up as much as possible with, again, having those breaks in between homework sessions.
Okay. Our next question comes from Sonia. Sonia would like to know, are moving classes from classroom to classroom disruptive for ADD students?
I think moving from class to classroom can be disruptive. I think that's why a lot of students have problems going from 5th grade to 6th grade in the U.S. because they go from having a couple teachers to 7, and it's also 7 different sets of expectations. You may have a class all the way across the school. You may have to stop at your locker for something. So, yeah, I think transitioning to other classes is very difficult for kids. Any kind of transition time is difficult for people with ADHD.
We have a medication question. One parent would like to know, what can you do if your child refuses to take his medication because he feels it changes his personality?
Well, I'd ask your child what they experience. I mean, they may be experiencing side effects. And there are different medications available. I'm assuming you're talking about medications for ADHD. There are different medications available. So if your child is reporting that they're not feeling like themselves, I would talk with your prescriber about maybe there needs to be a dosage or medication change.
Dawn would like to know, do you have any specific suggestions for improving focus and concentration during reading specifically?
During reading, first I make sure, is your child reading okay? Do they need to be assessed for a reading disorder possibly? Also read one line at a time. One of the things that I had kids do is put a index card over what they were reading so they could see one line at a time, and that helps processing. So also I would take a look at what time of day are you doing reading. So if you're required to do some reading every day, are you doing it right before bed where it might be a little tiring, or is it right when they come home from school and they need to unwind first? So I'd take a look at what your child's energy level is like when they're reading as well.
Okay. Our next question comes from a parent. This is, what about children who have auditory and behavioral problems that are thought to be the reason for distraction? The classroom teachers are suggesting that medication would help, but parents are against medication. What are your thoughts?
So auditory processing disorder, just like sensory processing, is not a diagnosis in our diagnostic manual, but I can speak to just the attention part. Well, first, people really shouldn't be recommending medication unless that's their field, is the first thing. And also you need to look at your school board rules as to whether teachers are allowed to recommend medication. So it differs on the school board. So that's the first thing. And second, you said that the parents aren't
against medication. So they don't want their child to be on medication.
I'm not really sure how to answer that. I guess it's talk to the parents more about where they're coming from, meet them where they're at, and offer them some options. The best non-medication treatments are exercise, mindfulness, good sleep habits, and omega-369, but always check with your doctor first before taking omega-369. And quality can change depending on brand because the FDA does not regulate supplements. So, but still, stimulant medication has been found to be more effective than non-stimulant medication and also any other non-medication treatment for ADHD.
Okay. Our next parent question is, do you have any recommendations or strategies for use of electronic devices for a 12-year-old with slow processing speed?
I have kids earn electronics time, so kids do that by doing chores, when completing homework, use as a positive reinforcement. And also, American Academy of Pediatrics recommends no more than 2 hours max screen time per day for kids over the age of 2, not including the use of laptop for homework. And also, more schools are using iPads instead of real books, but you can have on your 504 IEP plan that your kid can take home real books, or the school can print them out so your kid has something tactile to look at. I think that can help as well.
How do you address a problem when teachers and guidance are not following the 504?
If they're not following the 504 and you feel that your rights have been violated, first talk to them about it. And I would first assume that they don't know. And if you still aren't getting the answers you want, then I would consult with an attorney.
Okay. What are some techniques to help kids practice focusing while in school, especially when the school is not being as supportive and helping?
So what are some techniques to help kids focus when the school isn't being helpful?
Yes.
That's tricky because if the school's not being helpful, you're kind of missing out on the key supporters, as you probably know.
Right.
But I think part of it is your kid gets done with their work early, give them some enrichment work to do.
Okay.
Even if it comes just from you, something you found online that they can work on. That can keep kids occupied if they finish early. I think it's also look at, are they excelling past what's being taught then? And also, I think we also need to get to the root of what's the reason for the non-supportiveness. That can happen just because there's personality conflicts or just that's that person's style to not be as supportive. But I think it's probably time for a meeting with everybody to talk about how to resolve that.
Okay. Tara would like to know, what about lack of focus and unwillingness due to ADHD and ODD? Any ideas? We are in therapy.
Go ahead.
The last part is we are in therapy, but working with more than one issue is quite challenging.
So ADHD goes along with other things like anxiety, depression, oppositional defiant disorder, that's ODD, Again, 50% of the time. So that's pretty common to have a child that has oppositional defiant disorder along with ADHD. What that is that's the ADHD brain, it can't do some things instead of doesn't want to do some things. ODD, it's more like you don't want to do something. Like, will you take the trash out? No. Why? Because it's an automatic thing. And I talk to kids about, they have a certain amount of kid power, and they can use that power in a positive way or a not so positive way. And I ask kids, is using that power getting you, the way you're doing it, is it getting you what you want? And I get some really good answers to that question. So that's something to consider. Are they using that energy in a way that can help them, or is it actually hurting them? So I think that's an avenue you can talk about with your kid. And it does get frustrating. I think it's really important for parents to practice good self-care too, because we can't do all the things, right? So it's really important that we take time out to take care of ourselves. It's kind of like when you're on an airplane. You need to put your oxygen mask on before you put your kid's oxygen mask on, right? So you need to practice good care so you can be the best parent you can be.
Absolutely. Deb would like to know any suggested techniques for a 2E high school junior, rising senior, who can't stay focused on homework, especially English and history, He's strong in math and science.
So he's strong in math and science, but having difficulties in other classes. I look at, how are they learning? What is the teacher's style? Meet with the teacher, see if there's any additional way that they're learning. So what's working well in math and science, other than he's interested in the subject matter, that he's doing better in those classes? Is it multimodal teaching? What's happening in those classes? Is he going to see the teacher before or after school for help? Is there an attention issue? Because you can still hyper-focus in one thing and then not be able to focus in another thing. So an evaluation might be needed anyway, just to get a good baseline or start as to how the attention is.
Okay. Does redshirting a kindergartner who is struggling to keep up with peers, both physically and academically, due to ADD and PT issues?
So that means holding a kid back. So studies have found that when you hold a kid back, they actually do less well the second time they repeat the class. So, I've seen occasionally a kid that does better, but most of the time we see kids that just get more frustrated and more bored.
Okay. Good. Our next parent question, child with ADHD and SPD, avoiding writing in school. Do you have any recommendations to best address this?
To avoid writing in school, you can have it put on your 504 IEP plan that the child will be great on handwriting, and you can also use dictation software to do reports. Sometimes kids will tell me their entire report, but they're not able to write it out. So that's there's different software available. There's Dragon Dictation. There's Microsoft has a dictation built in. So does Mac. So I would take advantage of those instead. Or you can record your child speaking their paper and show that to the teacher instead. And you can have it added to the 504 that the teacher accepts that instead of a written report.
Okay. We talked about helping kids stay focused on their work, but do you have any suggestions or techniques that can help students stay focused on tests?
On tests, first I would have them do some deep breathing, so some diaphragmatic breathing, which is breathing with your tummy rather than thoracic breathing, which is up here in the chest. That's what you tend to do when you're hyperventilating. So practicing deep breath in, so inhale for 5, exhale for 10. Okay. That gets your dopamine up, your parasympathetic, your relaxation response, your nervous system kicked in. Also have the kid walk around the room or run an errand for their teacher with a hall pass before a test, because that moving around will increase your brain chemicals as well. Okay. And then emphasize that this is just a test. It's no big deal.
Got it. Is it typical for an ADD child to not do well in class and homework, but excel in testing?
Yeah, you can have kids that do well in testing and don't do well in class, and then the opposite too. So the consistent thing about ADHD is inconsistency. And you'll also sometimes see kids that get an A in science and an F in math, and then the next semester is the complete opposite. And again, it's that inconsistency that's really a key factor of ADHD. And I think when I talked about redshirting, I think what redshirting actually is, instead of having a child repeat a grade, that's just having them not go forward into kindergarten. And that again is and waiting if their birthday's right on that cusp. I think what I found is that kids, again, get bored when they're held back from going through to kindergarten. And then they wind up being one of the older kids in class, and that has some social stigma with it.
Okay. Our next question, do you have experience using the listening program to help kids with ADHD improve focus and attention?
I wrote about that in my non-medication for ADHD book, and has not been found to be effective for treating ADHD.
Okay. How do you help a child with focus issues, especially with sounds of machines like lawnmower or a leaf blower? Do you have any tips on that?
Sure. So some kids like having some background sound, and there are a lot of great white noise apps for that, or you can even get a white noise machine. Other kids need complete silence, and noise-canceling headphones are really helpful for that, or earbuds.
Got it. Carrie would like to know, what are accommodations to ask for in high school when a child has executive function and attention issues?
So 504 accommodations include having a note taker in class. So the child doesn't know who they're taking notes for, but the teacher gives the kid the notes. So the idea is that the kid isn't singled out for getting this accommodation. Also, having extended time on tests and testing a separate location. You need to have that already established in high school for ACT or SAT to consider giving you that for their testing. And even then, they might not give it to you. So also, you need to have, again, seated near the front of the room, seating away from distracted stimuli, just with younger kids. So those are the top ones. And not having handwriting count as a grade. I mean, you don't really do that as much in high school, but also being able to turn in everything typewritten instead of handwritten, which we're moving towards that anyway. But also for speaking in front of the room, like doing a group project, some kids with attention problems really don't do well in group projects. So it can be put in your 504 that you can do an individual project instead of a group project. And instead of staying in front of the room, because a lot of kids with ADHD also have social anxiety, that they can talk to the teacher and you give her or him the presentation before or after class, or record themselves doing it and give the video to the teacher.
Okay. And we have time for one more question. I'm sure we covered it earlier in the chat, but just in case people joined us a little after we started, why do kids have a hard time focusing on some tasks when they might not have any trouble focusing on things that they actually enjoy?
So ADHD is a difficulty with regulation of attention. So your attention's can be laser sharp. It's just your brain doesn't know when to switch attention, and it gets too excited by some stuff. Like video games, everything the ADHD brain likes is constant movement, constant color, positive reinforcement. And then there are things the ADHD brain just can't get revved up by. And it's just one of those factors. It's just how the brain works sometimes. So it's really important to note that you can still have ADHD and be able to hyper-focus on some things, to the point where it can be a detriment, where you're calling your kid's name and they don't hear you.
Stephanie, thank you so much for joining us today, and I do want to thank all of our parents for joining the conversation as well. I do want to remind everyone that you can find all of our archive chats at u.org/calendar, and if your question did not get answered today, please join our community. Check out u.org/community. Thank you.
Thanks.